What if doctors could predict how a cancer patient will respond to treatment, not by guesswork, but by reading the protein activity inside the tumor itself? Chinese scientists say they are now closer to making that possible for a difficult-to-treat cancer. In a significant step toward precision cancer treatment, Chinese researchers have developed a new classification system for nasopharyngeal carcinoma. The study, published in Nature Cancer, introduces the first-ever proteomic subtyping, dividing the disease into 3 distinct biological categories: S1, S2, and S3. Nasopharyngeal carcinoma is a type of head and neck cancer that is particularly common in China. One of the major challenges is that early symptoms are often mild or unnoticed, leading to late-stage diagnosis in nearly 70% of patients. At that point, treatment becomes more complex. Currently, the standard involves a combination of radiotherapy and chemotherapy. In many cases, induction chemotherapy is used first. However, a major problem remains. Around 20 to 30% of patients do not respond effectively. To address this, scientists from the Sun Yat-sen University Cancer Center conducted an in-depth analysis of tumor samples from 240 patients. Instead of focusing only on genetic data, they used proteomic profiling, studying the actual proteins active within cancer cells. This approach revealed 3 distinct tumor subtypes, each showing different biological behavior, prognosis, and response to treatment. In simple terms, not all nasopharyngeal cancers behave the same way. Some are responsive to chemotherapy, while others show resistance. By identifying these patterns early, doctors may be able to choose the most effective treatment strategy for each individual patient. One of the most important discoveries is the role of IgA-positive plasma cells. These immune-related cells may serve as a key biomarker. They help predict how patients in the S3 subtype will respond, allowing doctors to anticipate chemotherapy resistance before treatment even begins. This research represents a shift from traditional models toward what is known as stratified medicine, or precision oncology. Instead of treating all patients with the same protocol, doctors may soon classify tumors based on their biological behavior at the protein level. This is important because proteins are the actual functional molecules driving cancer growth and response, not just genes alone. It helps explain why 2 patients with similar diagnoses can respond very differently to the same treatment. If validated, this approach could reduce unnecessary chemotherapy exposure, improve survival rates, and make treatment more efficient. However, challenges still exist. Proteomic testing is more complex and expensive, requiring advanced laboratory infrastructure. This feels like a meaningful step forward in cancer research, especially because it moves away from a one-treatment-fits-all mindset. The real impact will depend on whether hospitals can integrate proteomic testing into everyday cancer care. But the momentum is undeniable. This study brings us closer to treatment plans that are truly tailored to each individual patient, rather than broad population averages.